Question 1. A patient taking warfarin reports frequent nosebleeds. What should the nurse anticipate? A. Increase the dose. B. Administer protamine sulfate. C. Check INR level. D. Withhold food. Answer. C. Check INR level. Question 2. What is a key teaching point for a patient starting carbamazepine? A. Take with grapefruit juice. B. Watch for signs of infection. C. Double the dose if missed. D. Limit sodium intake. Answer. B. Watch for signs of infection. Question 3. Which lab value requires follow-up in a patient receiving enoxaparin? A. Hemoglobin 12.5 G/DL. B. Platelet count 90,000/mm superscript 3. C. 1.2 Indian rupees. D. WBC 7,000/mm superscript 3. Answer. B. Platelet count 90,000/mm superscript 3. Question 4. A nurse prepares to give 4 vancomycin. What is the most important assessment? A. Temperature. B. Bowel sounds. C. Trough level. D. Capillary refill. Answer. C. Trough level. Question 5. A patient asks why diphenhydramine causes drowsiness. What is the correct explanation? A. It increases melatonin production. B. It blocks histamine in the CNS. C. It stimulates dopamine receptors. D. It enhances serotonin activity. Answer. B. It blocks histamine in the CNS. Question 6. What is the nurse's best action before administering digoxin to a pediatric patient? A. Hold if heart rate is over 100 BPM. B. Monitor respiratory rate. C. Assess apical pulse for 1 minute. D. Check capillary refill. Answer. C. Assess apical pulse for 1 minute. Question 7. Which statement indicates effective teaching about levetiracetam? A. I will avoid driving until I know how it affects me. B. I can stop at one seizure stop. C. I must avoid all dairy products. D. I can drink alcohol in moderation. Answer. A. I will avoid driving until I know how it affects me. Question 8. A patient receiving methotrexate is at risk for which complication? A. Hyperglycemia. B. Infection. C. Hypertension. D. Renal stones. Answer. B. Infection. Question 9. Before administering tamsulosin, which assessment is most important? A. Heart rhythm. B. Respiratory effort. C. Blood pressure. D. Urine output. Answer. C. Blood pressure. Question 10. What is the nurse's priority for a patient newly prescribed bupropion? A. Monitor for hallucinations. B. Assess for suicidal ideation. C. Encourage high-protein diet. D. Administer with meals. Answer. B. Assess for suicidal ideation. Question 11. A patient with CHF is prescribed lisinopril. What symptoms should be reported immediately? A. Cough. B. Constipation. C. Facial swelling. D. Dry skin. Answer. C. Facial swelling. Question 12. A nurse gives regular insulin at 0730. When is the patient most at risk for hypoglycemia? A. 0745. B. 0900. C. 1100. D. 1230. Answer. B. 0900. Question 13. A nurse prepares to give an intramuscular injection of iron dextrin. What technique is essential? A. Use a 25-gauge needle. B. Apply cold before injection. C. Use Z-track method. D. Massage the site afterward. Answer. C. Use Z-track method. Question 14. What is a priority teaching point for a patient on allopurinol? A. Limit fluid intake. B. Take with vitamin C. C. Report any rash immediately. D. Expect dizziness. Answer: C. Report any rash immediately. Question 15. Which medication requires peak and trough monitoring? A. Ceftriaxone. B. Acetaminophen. C. Gentamicin. D. Lorazepam. Answer: C. Gentamicin. Question 16. A patient reports muscle cramps while on simvastatin. What is the nurse's best response? A. This is expected. B. Call your provider immediately. C. Increase potassium intake. D. Skip the next dose. Answer: B. Call your provider immediately. Question 17. What instruction is essential for a patient taking nitrofurantoin? A. Avoid dairy products. B. Take at bedtime. C. Report any yellowing of skin. D. Take with grapefruit juice. Answer: C. Report any yellowing of skin. Question 18. A nurse is preparing to administer 4 morphine. What is the nurse's priority action? A. Check potassium. B. Review bowel sounds. C. Assess pain level. D. Count respiratory rate. Answer: D. Count respiratory rate. Question 19. A patient asks why alendronate must be taken with water while upright. What is the correct reply? A. It prevents throat swelling. B. It increases calcium absorption. C. It reduces the risk of esophageal irritation. D. It improves metabolism. Answer: C. It reduces the risk of esophageal irritation. Question 20. Which is the nurse's priority action before administering amiodarone 4? A. Place patient in Trendelenburg. B. Start on an empty stomach. C. Connect to a cardiac monitor. D. Check visual acuity. Answer: C. Connect to a cardiac monitor. Question 21. Which instruction is most important when teaching about transdermal fentanyl? A. Change patch every 24 hours. B. Apply only to the upper chest. C. Dispose of patch in the trash. D. Avoid heat near the patch site. Answer: D. Avoid heat near the patch site. Question 22. A patient prescribed lithium develops nausea and tremors. What should the nurse do first? A. Hold the next dose and notify the provider. B. Encourage food with medication. C. Provide antiemetic medication. D. Monitor for dehydration. Answer: A. Hold the next dose and notify the provider. Question 23. What is the priority lab to assess in a patient taking hydrochlorothiazide? A. Calcium. B. Potassium. C. Glucose. D. Creatinine. Answer: B. Potassium. Question 24. Which teaching is essential for a patient prescribed phenazopyridine? A. This drug treats the infection. B. Stop medication if urine changes color. C. Avoid exposure to sunlight. D. Urine discoloration is expected. Answer: D. Urine discoloration is expected. Question 25. Which finding is most concerning in a patient taking phenytoin? A. Gingival hyperplasia. B. Drowsiness. C. Unsteady gait. D. Mild rash. Answer: C. Unsteady gait. Question 26. Which action should the nurse take when a patient on ACE inhibitors reports a persistent dry cough? A. Administer bronchodilator. B. Stop the medication immediately. C. Notify the provider for a possible medication change. D. Reassure the patient and encourage fluids. Answer: C. Notify the provider for a possible medication change. Question 27. What instruction is most important for a client starting disulfiram? A. Avoid alcohol-containing products. B. Monitor for weight gain. C. Take with meals. D. Avoid dairy for 3 hours after taking. Answer A. Avoid alcohol-containing products. Question 28. What is a priority nursing action after administering epoetin alpha? A. Monitor blood glucose. B. Take temperature every 2 hours. C. Assess for hypertension. D. Encourage high-protein intake. Answer C. Assess for hypertension. Question 29. What lab value is most concerning for a patient taking atorvastatin? A. Alt 65U/L. B. BUN 18 mg per deciliter. C. LDL 120 mg per deciliter. D. Hemoglobin 13.5 g/dl. Answer A. Alt 65U/L. Question 30. A nurse is administering mannitol for. Which assessment requires immediate attention? A. Increased urinary output. B. Decreased intracranial pressure. C. Bibasilar crackles. D. Dry mouth. Answer C. Bibasilar crackles. Question 31. A patient prescribed tamoxifen should be monitored for A. Visual disturbances. B. Hyperkalemia. C. Bone pain. D. Signs of thromboembolism. Answer D. Signs of thromboembolism. Question 32. Which is the priority teaching for a patient starting colchicine? A. Avoid aged cheese. B. Report muscle pain or weakness. C. Expect increased appetite. D. Take with iron supplements. Answer B. Report muscle pain or weakness. Question 33. What must the nurse verify before administering alteplase, TPA? A. INR above 3.0. B. Platelets below 100,000. C. Blood pressure less than 180/110 mmHg. D. History of DVT. Answer C. Blood pressure less than 180/110 mmHg. Question 34. A patient on ferrous sulfate should avoid taking it with A. Vitamin C, B. Dairy products. C. Orange juice. D. Lean meats. Answer B. Dairy products. Question 35. Which finding in a patient on methimazole is most concerning? A. Mild weight loss. B. Cold intolerance. C. Sore throat with fever. D. Constipation. Answer C. Sore throat with fever. Question 36. What should a nurse do when administering 4-potassium chloride? A. Push it rapidly for faster absorption. B. Dilute and infuse slowly via pump. C. Shake the bag before use. D. Give only through a central line. Answer B. Dilute and infuse slowly via pump. Question 37. What is the nurse's best response when a patient on prednisone develops black stools? A. Increase your fluid intake. B. This is a harmless side effect. C. Contact the provider immediately. D. Eat more fiber. Answer C. Contact the provider immediately. Question 38. Which assessment is most important for a patient receiving magnesium sulfate for? A. Radial pulse. B. Pupillary response. C. Deep tendon reflexes. D. Capillary refill. Answer C. Deep tendon reflexes. Question 39. A nurse prepares to administer sumatriptan. Which history finding is most concerning? A. Seasonal allergies. B. Type 2 diabetes. C. Coronary artery disease. D. Occasional headaches. Answer C. Coronary artery disease. Question 40. Which instruction is essential for a patient starting levothyroxine? A. Take with food in the morning. B. Stop the medication if you feel better. C. Take on an empty stomach. D. Take it with calcium supplements. Answer C. Take on an empty stomach. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.